Hepatitis. We've all heard of it, but we don't entirely know what it is, especially Hep A, B, and C. So, what's the difference? So, hepatitis A is a contagious liver disease caused by the Hep A virus. It is transmitted through food that was somewhat contaminated with fecal matter. The first outbreak was recorded in the late 1970s, but infection numbers went down after the creation of the Hep A vaccine in 1995. Hep B is far more contagious than hepatitis A. It is transmitted through blood, semen, or other bodily fluids. The Department of Health in Australia created this short video in 2020 to help spread awareness of hepatitis B and how to prevent it.
Hepatitis B is a virus that can damage your liver and can even cause cancer. It is spread when infected bodily fluids enters the body. Hepatitis B can live in bodily fluids such as blood, semen, vaginal fluid, and anal fluid. A woman with hepatitis B can give it to her baby during birth. You can get it having sex without condoms and water-based lube, sharing needles or other drug-injecting equipment like tourniquets and spoons, sharing unsterilised tattoo and piercing equipment, even sharing razors, toothbrushes and ceremonial tools. A tiny amount of blood, too small to see, is enough to get it. Hepatitis B is not spread through sharing food or drinks, breastfeeding, hugging, kissing, holding hands, coughing or sneezing. Many people with chronic hepatitis B often don't feel sick and won't even know they have it. Some adults and children and most babies who are exposed to hepatitis B will go on to develop a chronic or lifelong infection. If they do become sick, it can take a long time to happen. Slowly, over many years, they may get tired and run down. They may feel sick. Their belly and or ankles may start swelling, or their eyes or skin might start turning yellow. The only way to know for sure is to get a blood test at your doctor's, your local health clinic, your Aboriginal medical service, or sexual health clinic.
With the help of these resources, we can prevent the spread of hepatitis B. Hepatitis C is considered to be the worst strain of hepatitis, though. According to Dr. Kuna, a U.S. board-certified emergency medicine physician, said that up to 70% of those chronically infected with hepatitis C develop chronic liver disease, and up to 20% develop cirrhosis. The number of hepatitis C deaths has been steadily increasing for more than a decade. In 2014, there were 19,600 deaths due to hepatitis C, compared to the 1,800 deaths from hepatitis B. Hepatitis A rarely kills anyone, so the numbers are incredibly small and essentially non-existent. Symptoms of Hep C include fatigue, jaundice, nausea or vomiting, loss of appetite, bleeding or bruising, and dark urine. If you have any of these symptoms, please consult your doctor. Like I said, since 2010, the numbers of people infected with Hep C have steadily increased. Since there is no Hep C vaccine, the best thing we can do is avoid cross-contamination with an infected individual, prevent sharing anything that could be contaminated with blood. Some people might not even know they have it, so it's better to be safe than sorry. The administration of the Hep A vaccine shows a tremendous amount of success in the 1900s. Hepatitis B was a little slower, but there was a sharp decline in the number of cases in the years following the creation of said vaccine. To create a healthier tomorrow for yourself and for the people around you, get vaccinated and help stop the spread. We can do this, but only together.